Patients may not remember every medical detail, but they always remember the physician who gave them hope, listened without rushing, and made them feel like they mattered. Welcome to the Global PAD Impact Awards, where we celebrate the physicians, care teams, researchers, innovators, and organizations changing the future of peripheral artery disease, or should I say, changing the now and the future of PAD care, one patient at a time. And today we are honoring exceptional PAD patient care and compassion. It is my honor to recognize Dr. Christopher Stout out of Rogers, Arkansas. Dr. Stout, this recognition comes from the impact you've made on patients as people, not just as cases. You have advanced skills, of course, but above and beyond that, when you're in there with these patients, you are truly making a difference with who you are in treating them as true human beings, not just as numbers. So, what do you believe every patient deserves from their physician, regardless of how complex their disease may be? It's a good opening question.
Yeah, that's a good question. And I've got, 2 points to make on this question of why and how, I practice medicine. I'm from a small town. I grew up in a small town. So I think that that had quite a bit to do with it because you knew everybody. Everybody knew you. My best friend's grandma also told me, Stout, you need to think about what you're doing because you got a football game, next week or you're going to go to college. So I had a whole town of people behind me. And I think knowing that having a whole town of people behind you to succeed and do well means that you need to go out there and you treat every patient as if they're somebody from your hometown, their family. And that's the way I approach medicine. And that's how I want to do it. My patients get my cell phone number, and it's as simple as that. I treat every patient like they're my own. And I think that's very important as you go through medicine, because early in your career, it's easy to see everything as a disease. It's a case, it's a
Yeah.
number. And as you go through your career, you slowly develop the fact, well, these are actually people, and it's fun to have conversations with them. And luckily, I was able to have that from the beginning of my career, from the way that I was raised and the experiences I've had in my life, living in a small town and going through med school and all that. And then I would say probably the second most important thing is that I had an attending once. He was a French Canadian guy, and he told me, Dr. Stout, just remember, you're always going to be a blue collar surgeon. So I've never forgot that I'm going to be a blue collar surgeon from here on out, and these people are my people.
It's interesting because you and I met when you were in a large hospital system. And I remember that conversation where I said, wait, hold on, Dr. Stone, where are you going? I have no one there. What are you doing? And you said, you know what? You're going to love me even more here because I actually am going to have time to get to know my patients, to spend with my patients and make a difference beyond the operating room. And that has always stuck with me. And so it was no surprise when patients came to me and they nominated you for this award. For those who are watching, this patient nominated award. You're truly doing what matters to human beings out there that cross your path.
Yes, and being nominated for this award is, thinking that this extends throughout the whole US is quite amazing to me. I'd never had a clue that I had this much impact on my patients. I just enjoy talking to them, getting to know them. You get to know a patient and you start to understand their life, then you can understand how you're able to enact changes in their lifestyle. And I got patients out there that they've been smoking green tobacco since they were 12 years old and trying to figure out, why and how and their lifestyle. And they've been farmers their whole life. Telling somebody like that, we're going to get you to quit smoking, within 3 months, it ain't going to happen. It's something that you got to work with on every visit, and you've got to get to know them, and you've got to be real with these patients and basically teach them, hey, this can be done. There's other people in the similar situation that's been through this, so it's not impossible. It just takes a lot of mindset and knowing and understanding these patients and basically applying your treatment strategy in terms that they can understand, and also letting them know that basically I'm going to unclog your intake manifold and clean out your fuel lines. That way your engine can work better. And then we got to come back and take care of your exhaust because your veins aren't any good. And then we'll get you to heal up this wound. Talking like that, that's what gets the patients to actually be compliant in therapy and actually show up for appointments, and they do very well.
Hey, doctor, I don't really understand. I mean, you said that my thigh, I have a blockage in my thigh. What does that mean?
No, so blockage in the thigh. That can mean a number of things. So first thing I need to know is, hey, have you had anything done? Have you been anywhere else? Because there's a lot of people out there that and they're just out there to fix the disease process and they're not worried about the second round. So then we got to figure out, okay, is a blockage in an artery or a vein? Have you had clots? And then we get to talk about what are arteries and what are veins, and that helps to educate the patient and gives them a little bit more idea of why we do antiplatelets versus anticoagulation or blood thinners versus aspirin and Plavix, etc. Going through all of that will help to educate the patient. Then you can get down to, all right, we did an ultrasound, which we can do in the office, which is super nice. And yeah, you have a blockage in your thigh artery. What symptoms are you having from it? Because not every single one of these needs fixed. If you have a wound or gangrene or something like that, that definitely need to be fixed. But there's some other things that we can do. So I need to know more information about what is this blockage in your leg, and getting to know the patient, getting to know their perspective of what this blockage is, that'll help you to be better equipped to treat the blockage.
And I love what you said before about especially the lifestyle modifications. The number one thing that I hear from patients is they need and desire the accountability, and their doctor is not enough. The 15 minutes they have, it's not really enough. The general sterile conversation they have is not enough. The conversation that you were saying that you have with these patients, they, hey, fellow farmer, neighbor, type of thing. When a patient feels that camaraderie, that brohood, with you, you're better able to get them over time to kick the habit, whatever it might be, that is leading to their blockages.
Yes, definitely. And also through these relationships, when my teenage kids gets in trouble, I can send them out to work on the farm with these patients of mine. So I also give them some free labor. Um, but I think overall, the biggest thing is sitting there and talking with your patient. Just having that time to get to know them, get to know their family, get to know the obstacles of their treatment. It may be financial, it may be they have a distrust in this medication. It could be a number of things, and you got to sit down and know these patients. And since I've changed my career path from academic doctor to hospital employee doctor, now to private practice in an OBL situation, and um, I've I've learned that I've developed the ability in my career to now sit down with my patients in private practice. It's the biggest boon I've ever had. I have 30 minutes to see a patient now, whether it's a new patient or a consult. Sometimes it takes 10 minutes, sometimes it takes 15. Sometimes that patient needs a good 45 minutes or an hour talking about whatever disease process is affecting them, and getting together with them and figuring out how we're going to go about treating this as a team. It's not, I'm going to fix your leg. It's, hey, you and I are going to do this. We're going to start you on an aspirin. We're going to start getting you walking. Kim has a great pamphlet and book for walking programs. We give those out all the time. And going through that process of just getting the patient to understand the disease process rather than saying, you have this, here's what we can do, or we can do this, or we can do nothing, or we can do medicine, and your time's up, next patient. That's not the way to practice medicine. Unfortunately, that's the way we're going, but still, I have a little piece of heaven on earth. Thank
Yeah.
goodness.
I love it. And we have Sherilyn that's watching on YouTube that says she knows you, she likes you. And one of the patients that in particular that really stands out to us is someone that came in from the state capitol and up to Rogers. And she went for what, I don't know, 30, 40 years with swelling in her left leg and debilitating pain. And you were the first person to say, have you ever been tested for May Thurner's? And nope, hasn't. And so for the first time in her life, she doesn't have any pain. And that's pretty incredible. But the fact that you sit there and you listen and that you don't just brush people off when some doctors don't know what something is, they just brush them off. Oh, it's just your back. It must be your sciatica. Oh, it must be the arthritis. It must be, must be, must be. We have a guy in the hospital right now that had his spine shaved to take the pressure off of one of the nerves, and it wasn't the problem. I mean, going through a procedure like that when it's vascular, it's plumbing, that's really disconcerting. So, yeah, I
Yeah,
can see.
that's it's really concerning seeing that. And just like a lot of the other interventionalists on your panel, we see the patients that have gone through back surgery, and then we manage to fix their legs and place a stent, or do an atherectomy or an angioplasty or whatever we do. And a lot of times this can take 45 minutes as an outpatient, and they go home the same day and they show back up a month later with ultrasounds and, yeah, you look great. How are you feeling? Patient says, well, probably should have never had those 2 or 3 back surgeries because I feel perfectly normal now. And it's very difficult to distinguish neurogenic from vascular or blood vessel type claudication where it hurts when you walk. But at least we pick these patients up when they develop wounds. So we can get them straightened out, not only fixing the disease process, but getting their life turned to where they're following the advice that they need, the diet, the exercise, the medications. And it's so nice. There are patients though that I've seen myself that I guarantee you this is vascular disease. Putting these 2 stents in the arteries in your pelvis is
Mhm.
definitely gonna make you better because it's the head of the river. And yeah, they got a little bit better, but I've had 1 or 2 that had to go for back surgery too. I got, surprised by the testing. Testing is good, it's not perfect. But I do think that education of vascular disease to all the primary care doctors, the internal medicine doctors, it's something that you don't really experience. And it's not a good education that you get in med school. The only reason I did a vascular rotation in med school was because I wanted to do vascular surgery. Otherwise, I would have had no exposure. I would have not known what an arterial duplex ultrasound was of a leg or an ABI. And going through general surgery training and seeing, working closely with the internal medicine residents and the family practice residents, there's not a lot of exposure to vascular surgery, unfortunately. So what you're doing and what everybody else is doing to bring this information out is just so important, because patients don't understand. A lot of times their treating physicians don't exactly understand. And really, nobody has the time to figure out what is going on these patients, not only medically, but also personally to help them.
Yeah. So, Dr. Stout, I'm going to introduce you to a patient, but you only get 5 pieces of information. So, it's a male. He's 62. He has diabetes. He quit smoking 10 years ago. His calf hurts when he walks across a parking lot. He hasn't told his doctor because he assumes it's just age. He's just getting older.
My guess is that his doctor probably told him, "Oh, you're just getting older, deal with it." Kind of like what we see with a lot of women's health that we do. Oh, you're just a woman, just deal with it. It's just the way it is. I, I challenge everybody out there to never accept the answer, it's old age, or you're just a woman, it's the way it is. Get a second opinion. And if your doctor refuses to give you a second opinion, fire that doctor on the spot because he's no good. Because he is afraid of what somebody else is going to say. I'll offer second opinions all the time to my patients. There's no problem with that. Two heads are always better than one. We know that if you bring in a mix of people, you always end up with a better result when you're working together. So this guy who's got diabetes and he's quit smoking, but he has smoking in the past, and his leg hurts, and he's told, well, it's probably just old age. Just do what you can, work it out, stretch, maybe send you to physical therapy. We see these patients a lot, and generally they come in. The first thing I do is I give them a high five because you're not smoking. That is the number one risk factor that I'm like, good job, buddy. You and I, we can work together as a team now. And then we look through their medications and figure out what they're taking and all that stuff. And then we go into the exam and we check the pulses. And generally, the pulse exam can tell us quite a bit, along with their history of when does the pain start? Is it when you first get up? Well, okay, you got arthritis. Is it when you've been up for a little bit and you're walking? This very well could be vascular disease, or also it could be the neurogenic, as we discussed. So then doing a simple ABI test with or without exercise is going to be my first step on this patient and determine, does he have peripheral artery disease and do we need to educate him about this?
What worries you the most about the fact that this patient hasn't walked through your door before this?
That nobody's referred him over to me and he has not been receiving the medical treatment that he really needs to prevent strokes and heart attacks, death, and limb loss. There is right now, vascular disease and cardiovascular disease kills more people than almost all cancers combined. Almost all
Yeah.
cancers combined. It's crazy. And there's not that much attention given to the peripheral artery disease aspect of it.
So now let's say he's 42, no diabetes, active, doesn't smoke, but something about his leg just doesn't seem right. Does your level of concern change?
My level of concern changes because the first patient with diabetes and a history of smoking, and now with leg pain with walking, most likely has peripheral artery disease, and that has huge implications for his life expectancy. Not only life expectancy, but also living a quality of life until reaches his age of when he's going to die. So I'm more worried about that patient than I am the younger patient with this disease process. But again, the younger patient, you need to be concerned because there are quite a few other types of diseases that affect younger patients. You got popliteal entrapment syndrome, you got popliteal adventitial cyst. This patient could have super advanced peripheral artery disease. I've seen PAD in patients in their 30s
Yeah.
and these patients don't do well. So either way, both of these patients, as soon as they start having these symptoms and they prove that they didn't pull a muscle over about 6 or 8 weeks with stretching, etc., they need to be evaluated, at least by the primary care doctor, checking their circulation, make sure that they can check good pulses. And again, how good is a pulse exam? It's very subjective. So I really rely on objective testing, such as an ABI test that can be performed for about $75.
It's so concerning that I don't understand what's going on. We're seeing patients between the ages of 18 and 40 increasingly showing up in emergency rooms with critical limb ischemia and even acute limb ischemia just on deck for amputation. I don't know what it is. They're showing up with the higher risk factors of the diabetes, the heart disease, the high cholesterol, all of the above. And I mean, where is this all coming from? We have one 32-year-old, one 37-year-old African American, both African American females with weird clotting and very high LP little a, but I've never seen the LP little a cause clotting like this at this young age that I mean, I know of or I've been made aware of. It's
Yeah.
incredible.
Yeah.
I don't what's happening, Dr. Stout.
I don't know. It's definitely a risk factor for, clotting and PAD and acute limb ischemia. But I think that we're seeing the evolution of being in a Western civilization where we have exposure to multiple foods that are very inflammatory. And I think that if we could eat more fruits and vegetables, things that you actually have to wash under the water, then eat them raw is super healthy for you. We eat a lot of processed foods, and I think you take that along with we've told everybody you got to quit smoking cigarettes. Cigarettes are so bad for you. We should have had the message you need to quit nicotine altogether because nicotine can lead to swelling in the arteries and etc., along with the other inflammation. I think that over the next 5 years, we need to quit focusing on quitting smoking and start thinking about, you know what? these pouches, these vapes, all of these things are going to contribute to you developing heart problems, leg problems, etc. But the question is how do we do that? I don't have a public health degree, but I do think that, in school at some point, we teach these kids all types of things about health. We do need to probably teach them a little bit more about the number one cause of death of all Americans.
Yeah. So, what's something that a patient has said to you that you've never forgotten?
Um, I've had a couple of patients tell me things that I've never forgotten. The first one was a guy from North Carolina. And most of you watching, if you don't understand North Carolina, the type of topography it has, basically on the north and the east part towards the ocean, it's a swamp. They call it the Great Dismal Swamp because back in the settler days when they were settling Virginia and all them states, everybody died there because it was a terrible swampy place. Um, but I actually operated on a young man there. He was a young guy. He was 35 years old and he had developed Berger's disease from smoking. And that's a disease that smoking ends up causing your arteries inside the arteries, not necessarily inside the artery, but the rim of the artery would swell up so much that it would lead to occlusions of the artery. So he quit smoking for me, which is the treatment for this disease process, and his arteries didn't open. And I was looking at amputating his leg because that's what everybody said to do. Oh, you need to cut it off. There's no way that anything is going to work. This guy had a common plantar artery, was a first named artery below the groin. So I did a common femoral to plantar artery bypass below the ankle and used his own vein. It took a long time. And this guy, he quit smoking. He did great. That thing's still open. He is still kicking. And that was like 8 years ago. So we avoided his amputation with this bypass that if you look at the data, it shows that, yeah, this bypass has a 60% chance of lasting 5 years. Well, in the 35-year-old guy, you're better off cutting off a leg or doing a bypass that might last 5 years. I talked to the guy and I gave him the options. Hey, well, I got to work. I got to do this. I got to do that. He's a blue collar guy. I'm like, well, perfect. I'm a blue collar surgeon. We're going to do your bypass. We're going to try and get you as much time as we can. And if it starts to go down, then we'll do what we have to do. Well, and I said, as long as you stop smoking and you eat a diet that is heavy in fruits and vegetables and lean meats. And he did it. And I checked his urine cotinine, which will detect nicotine in urine for up to a month, and it was negative. So I did his bypass. He did great. So this guy looked at me. He goes, Doc, I didn't think that I could ever like a doctor ever, but you're my favorite now because you're the only guy that told me that my leg could be saved. So that was, a good feeling. And then I did another bypass on a guy, and his was just a FemPop bypass with vein. He had a big wound. His big toe was all black and necrotic and all this stuff. So we did the bypass. I get him to my podiatry friends. We get him to plastic surgery. We get him endocrinology, trying to get this limb salvage going on this guy and discharge him from the hospital 3 days after the bypass. And he comes back to my clinic about a month later, says, Doc, I need my staples out. I'm like, what are you doing? You're wearing socks. His socks are all dirty. He's, well, I've been fishing for the last month. My leg doesn't hurt, so I'm fishing barefoot in a boat with water all over it in a lake. And then the guy looks at me and goes, by the way, you mind if I sleep in your parking lot in my truck? Because he didn't have a home. And so we're like, yeah, sure. Anything else he needs? He goes, well, you got any food? So we got him food, we got him some clothes, we got him all this stuff. And he comes, turns out he was a professional guide for striper fishing, but ended up in a bad way and some addiction and other problems, but was in the process of turning his life around. So I was really surprised that this guy was homeless. And the only way I would have ever known that was by sitting there and talking to him for 30 minutes. Like, why are you barefoot? Why are you doing this? Why are you fishing? And eventually I figured out, yeah, he just got divorced and he was trying to do his best and getting over addiction and all these other things. So it was an office and a practice. I wasn't in a hospital-based system. I'm in private practice. We took a donation for the guy. We got him money. We got him food. And he's able to sleep in our parking lot anytime he wants in his pickup. Everybody knows. So probably not what you're expecting on things I've heard. But I think those are some of the most important things that they mean a lot to me because these people are humans and we're all humans and we're supposed to take care of each other.
That's absolutely incredible. There was a patient that we helped, and he came all the way from also the capital in or nearby, and we ended up getting him a hotel. You guys helped us find a hotel for him because he's like, I'm not going to anyone else but with Dr. Stout. And we had yet another one that and you mentioned the second opinion, and I have proof that you are that guy that will say, I don't care who they see. Like literally, they can get second and third opinions. Good. The more informed patient,
Yep.
the better. And you were offering to make the phone call to the other doctor to make a seamless
Mhm.
transition, for that consult, which is incredible. But I'm curious, has a patient ever truly changed you? You've helped so many patients, right? You've changed their lives, but has a patient ever changed you?
Um, I think that patients have changed me. You know, going through your initial training, you're coming out, you're full of bravado. It's, oh, I'm gonna tackle the word. I'm a big bad surgeon now. There ain't nothing I can't fix. And you come up against some of these patients that they are they're just looking for help. They're like, anything you can do, doc, anything at all will help. Here's what everybody's told me. Here's what I've had done. And I used to be like, okay, here's what we're gonna do. Boom, 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 boom. And over time, the patients have taught me that that's not the right answer. You can't just listen to somebody for 30 seconds and then make up your mind. The patients have actually helped me learn to listen. And I consider myself, I'm well trained, and yeah, I learned how to listen per medical school standards, but the patients actually taught me how to listen. And I had one patient, he's a retired Air Force patient, and I still, meet up at the pizza place up in Bella Vista here, and, we grab a pizza or drink a beer together or something like that. But he told me, he's like, Doc, you listen. Like, there's no other doctors around here that listen. And I can't say which patient or patients taught me that, but I think that I started out full force, 100 miles an hour. And I think I slowed it back down to, 55 miles an hour and started listening to the patients. And the one of the things that we learn is, slow is smooth and smooth is fast. So I go slow. I learn everything about this patient, and instead of doing multiple things for this guy, I can do fewer things and over a same time period by listening to him and figuring out what is the problems and the roadblocks for him getting better. That will actually decrease numbers of interventions, increase compliance, and improve their outcome overall. So those are probably the most important things that I've learned from the patients and overall. Um, Probably the neatest thing I learned from a patient, though, was Gibraltar. I had a patient that came in. He had a leg problem and he wanted to pay cash. He was in his mid 20s, and I fixed his leg problem and told him he needs to follow up in a month and 3 months and 6 months and 12 months later and get ultrasounds to make sure everything was going to be fine. And he looks at me, he goes, that's probably not going to happen, but I'll call you if anything else happens. I need you to be available 24/7. It was kind of funny. This guy also was heading to DC because I was also in Virginia when I was doing this, and he lived up, close to the outskirts of DC. So um, that guy, I figured, is probably some form of intelligence officer and has been all around the world because he said, name a city, and I bet I've been there. And I named everything I knew, from my small town Kansas stuff, and basically Gibraltar. He said Gibraltar is a place he would live forever. So that's what I learned is my next vacation when I go overseas, if I ever make it, is going to be Gibraltar, based on what he taught me.
Wow. Um, so I want to know, you mentioned about the listening. Can you explain kind of like the most defining moment in your career that may have led to you becoming a better listener and patient saying, hey, you know what? He really listens because not all doctors do. They end up and you get out of school, right? And you talk, 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 just like I'm talking. I had a patient say on our YouTube channel, gosh, that girl just blabbers on. So so I'm
Yeah.
calling myself out. At what point, what was that defining moment in your career where you actually said, gosh, I need to talk less, listen more?
Yeah, so a lot of times a patient will come in and you're trying to strike up conversation. And back when I had little kids, I learned two lessons. First one was uh, wait till they're teenagers. That's what a patient told me. So yeah, and my teenagers are teenagers now. And then the second thing was I had a patient come in and he's sitting there and see me for the first time. And I walk in, I put my hand on his shoulder, and he looks at me and says, "Don't ever put your hand on my shoulder again." I'm like, "Yes, sir." And so I started like, "Mr. So and so, what's going on with you?" He goes, "What are you doing?" And I'm like, "What do you mean?" He goes, "You didn't you didn't listen to me from the beginning. I said, get your hand off my shoulder." I'm like, "Yes, sir." And he goes, "You should have apologized." I'm like, forgetting my please and thank yous. So I told him, I go, "I'm sorry. I didn't mean." He goes, "My shoulder hurts really bad because I got this problem and that problem." I'm like, oh my gosh. So that right there taught me listen to your patients because they may not be mad at you. They may not be upset. They may be upset. They waited 45 minutes. They're not mad that you touched them. They got a problem. So sat down. I'm talking with this guy a little bit more and figuring out what's going on. He's got radiation burns to his legs from growing up in Utah and playing in uranium contaminated springs and creeks and rivers and stuff. Amazing enough, his dad was an engineer that built the uranium mines. But anyway, over a period of about 2.5 years, I've gotten to know him very well. My first impression was this is the grouchiest, meanest, probably unsavable gentleman I've ever met in my life. He grumbles at my nurses, he grumbled at the front staff, but I sit there and I get to know this guy, and he is super interesting. And he's got a reason why he's upset. And there's multiple things from, living in these contaminated mines from the US government. He missed a cutoff by 2 years from getting his health care. So he's paying for all this on his own. He can't work because I had to remove one leg, unfortunately, because I tried skin grafting, muscle flaps, PRP, everything, and it failed. And the other leg, we're making progress finally with some other skin substitutes, but unfortunately, they cut the reimbursement for that. So he's probably going to lose that leg now, which is a whole nother discussion. Absolutely ridiculous. But I went out to his house one time and he goes, "Thanks for coming out, Doc. I think that you really care about me as a person." And he goes, "You basically changed my life by just sitting there and listening to me." And now he comes into the office. He'll grumble at the front desk. He'll grumble at the nurses. He'll grumble at me. But when he walks out, he smiles at everybody and winks. So that's that guy.
Oh,
So,
that's amazing. I
yep.
love that story.
So,
So, one more question for you. Um, Walking is the best medicine. You mentioned it earlier. You mentioned how great you are at talking to your patients and holding them accountable and building that relationship to get them to take more steps to better health. So we have a series called Go with the Flow, and it's all about walking as medicine and giving your best motivational speech and or sharing a story. of someone you gave the speech to, what the speech was and the impact it has. So you can take it where you want with it, but it's for a separate educational series we call Go with the Flow, to inspire people to walk, 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 to grow those natural bypasses and improve their vascular health.
Oh, definitely. And that's one of the things. And another pet peeve of mine, we go through, I'm a member of the Society of Vascular Surgery, American College of Surgeons, all these surgery specialty websites. And you know where the best literature for my patients to what walk is located? On your website, Kim. Your website.
Oh,
It's
no way.
1,000 times better than any of these societies. So that's where I direct all my patients because they need to know this information. I can
Yeah.
sit down there and draw this out and recreate it, maybe use AI or whatever, but why? You have it there. And pushing my patients towards, hey, you need to walk. Well, that's not what I want to hear, doc. I want a quick fix. Everybody wants a quick fix. My neck hurts. I want a quick fix. I don't want to have to go through physical therapy and all these other things, but they want the quick fix. But I'm like, no, you need to try this. Just try this for me. Humor me, try this. And the reason I want you to do this is because anytime I do anything to your leg, that could fail and put you back to where you're at now. It could make you possibly worse. So try this first. And talking these patients into it is almost impossible until I break out the folder, the little trifold pamphlet, and here you go. You're going to keep track here. You're going to keep track here. And when you come back in a month, I want to know what it is. And I liken it to a primary care doctor looking at the patient's blood sugars or their blood pressures. And, we look at all of that stuff too. And I don't harp on the patient too much, but I do tell them that anytime their hemoglobin A1C goes above 6, they're basically knocking out all their infection fighting cells.
Yeah.
But teaching them or showing them something like a picture's worth 1,000 words. That's basically the premise of what I'm trying to say is I can talk all day long. It's kind of like me when I was a teenager listening to my parents. They can talk all day long. I'm still going to go do what I want to do. But if my mom handed me a picture of something and said, here it is. Here's Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, Monday, and you just got to check in and write down how much you walked. Make it easy. If you can't change the person, change the environment. And that's what we're trying to do. And I think with your help, that's been very good.
Thank you so much. Dr. Christopher Stout, one of our award winners for compassion and PAD care. Thank you from the bottom of my heart and on behalf of all of our patients who nominated you and all of your patients as well. I'm sure feel the same for all you do to save life and limb with so much care and compassion.
Yeah. I would have never guessed that I would have gotten this award. I just go to work and do what I was taught. Treat everybody like you want to be treated yourself. And if we all practice medicine that way and all live life that way, I think that it would be a better world.
And for those that are watching right now, they have an incredible event coming up. We're going to be talking about it on September 12th. It's their Pause for PAD, Walk, Wag, Raise Awareness for PAD. It's going to be an incredible event. But where can they go to learn more about it? Do you have a website that they can go to where they can sign up and show up?
Yes, we do. What is our website, guys? It's if they go to our Ozark Regional Vein and Artery Center website, which I'd have to pull it up to look at it real quick, but that has the sign up plus um to your website, Kim, save a leg, save a life.
Yeah, they
Or no,
can
the way
call
to
our
my heart
Lifesaver
dot
hotline.
yeah,
And
the way
I'll,
to my
I'll give it to them.
heart.org or the yeah. Yep,
Yeah, if
either
they
one
come
of
to, if you
those.
guys give us a call, I can get you guys directed right to their Pause for Pad. They're in Rogers, Arkansas. Come from all over Arkansas and make sure you show up for this event. It's on September 12th. We're going to be going live there. So we're really excited about that. We're actually going to be joined by Dr. John Phillips, my co host for the Heart of Innovation. We'll be live from there. So excited for that event. So thanks everyone for joining us and join us then.
Awesome.